what is the difference between David and fitness devices? And I've been answering this so many times that you can say I'd get bored, but I can't, because most of these people are newcomers and they don't know about the background and everything. And they kind of look like fitness devices from the outside, but they are not. They are certified medical devices, and they're very accurate. They are computerized, which means that the control elements in the system is completely different to what fitness devices can ever be. And so in order to make it more easy to understand, we have used this analog that it is like comparing this to this. So both are good for cutting, but you would not go to an operating room with a kitchen knife. So they have their place, but they are different. So in that respect, when people learn to understand a little bit deeper, the difference is, there is no question, but it's always something we get asked in the beginning. Okay, now let's move to business opportunities that this new technology market opens. And you can say that, yeah, it's there, but does this investment make any financial sense? And investing in healthcare is nothing new. People are spending millions on high-tech devices, and nobody would pay a penny for these unless somebody developed a business model over time that justifies these investments. So there's a kind of history which makes the next MRI guy, it makes his job easier, because he can say, yeah, we do the same but better. But if you go to physical therapy world, it's a little bit different. The investment size is from hundreds to a few thousand, and there is no tradition to look at it from the business point of view. What therapy centers are investing is people, and that's perfectly fine. Good people do a good job, but people are not machines. You cannot depreciate them. You cannot amortize them over a year. So it's a different world, and therefore different to comprehend. And one of the questions we get asked a lot is, why should I invest when I get exactly the same amount of sessions without any investments? So yeah, that's a valid question. And in many countries, like in the US, this is exactly the case. If you want to get paid by insurance, you have to have one-on-one. There are countries like Germany, for instance, that allow one therapist to treat 3 patients and still get paid by insurance. The amounts are less than what you get paid in some countries for single patients, but at the same time, treating 3 makes a lot of financial sense. And for the insurance company, they know it's a structured program with accountability, and it's kind of a win-win situation. So I believe over time, this will change in the US as well. But when we start looking at it, this technology opens new opportunities that are beyond these insurance-paid markets, and we can look into that as well. But before we go there, we always have to ask a question, and actually it's the only question we need to ask is, do you have the patient numbers to make it work? So if there are the number of referrals that can fill up the clinic, everything else is just numbers and easy to work with. But if you do not have it, then definitely our job is not to try to convince you to invest into something that doesn't make sense. So there are many places where standalone clinics have invested in this, hopefully, and hoping that they are starting to get the volumes, but maybe they don't have the network to do that, and we don't like this to happen to anybody. So when we talk about the financial profitability of these sort of investments, we have to realize that the session price, how much you charge, is just one part of the equation. An even more important part is what is the session cost. So session price minus session cost times volume is the profit loss. And I will go through a couple of examples. Here is one example of a center that has one-on-one patients, 1 to 3 and 1 to 10. And we can see that the worker cost, staff cost is highest by far in the 1 to 1, 1/3 in 1 to 3, and only less than like 7-8% of the 1 to 10. And the reason there is that with 1 to 10 and self-pay, we can use self-paid models, we can use instructors, not like tech workers or whatever that you call them, but that you don't need to have physical therapists there. Then you have your facility costs, you have your investments, and if you think that €2.84 per session seems low, that is the case. It is exactly like that. It's all about volume, and having a live case that shows that is the case. Then you have other costs like marketing and whatever. In this particular case, the center is big enough that there are managers who are not producing, so those costs are higher. But in total, you can see that the range is from €55 to €12 in producing a single session for the client. And then when we look at the income, €70 per one patient, 35 for 3 patients, and €20 per 10, then you can see that the 1-to-1 definitely has the highest margin compared to 1 to 3 or 1 to 10. But when you use the volume, then things turn around, because you have absolutely the highest volume in the 1 to 10 category, and the next on the 1 to 3. So when you look at the profitability of these things, you have to calculate not just the single session profitability, but overall what that means for the center. So how do you get this volume? First of all, you have to expand business hours. We see that many physical therapy centers are open only normal working hours. Some are extending it up to 8 o'clock or 9 o'clock, but they all have empty time. And when you talk about rent and investments and others, and you expand those hours, you can divide it with more numbers. So it makes a lot of sense. Then of course you want to expand your customer base. Typically this 1-to-1 patient is the starting point. In Germany, for instance, it is only used for testing and evaluation, and then the patient is immediately moved to 1 to 3 group. So we have also centers that have 1 to 6, 2-hour sessions, very serious cases, psychological problems, and one therapist can easily handle 6 patients. And then you have the maintenance 1 to 10, and this 1 to 10 is not really the upper limit. It's just a practical limit in many cases that 10 people at the same time in the building with certain devices and space is maximum, and you shouldn't really push it. But if the place is bigger, it can be bigger, because these patients, these clients, you can say, are already through the program. So in some countries, it's a 3-month program, and that means that they already know exactly what they're doing. The therapist needs, or the instructor has to do very little work with these guys. Can be there to help answer questions in the program, or they have something happen to them somewhere else. And, it's more about feeling that it's a quality service. And I think it's very, very important to understand that we don't want to turn this into a gym. This is something we have to make sure we don't do. It's a medical service, self-paid medical service, but it is run by professionals. You have your own time slot. so you are not really just walking in. And you need to keep the image of the center. This is a very, very high quality service in the end, and people need to understand that. So here is just an example of a real clinic, and you can see that it's a pretty high volume clinic. We see here 24,672 sessions in a year. And why I wrote surviving COVID is really because if you look at the dip here, I think it's relatively mild, thinking about the devastation that this problem has caused in healthcare in many, many places. So I think it's also a testament of the fact that if you have a high quality medical place that is well kept and where the protection is well taken, people are very safe. They feel safe about coming there. They would never go to a fitness club, but they would come to a place like this. And this is ideal with the social distancing for people that are fearful of their health, but still want to maintain their functionality. So 24,672 sessions. Now, we have developed this sort of a feasibility simulator. And this simulator really is to analyze if it is feasible to set up a clinic. Like I said, the patient numbers are key issue. Of course, the space and some other things are key as well. So what we have is we can select here whether you have 1 to 1, 1 to 3, 1 to 5, 1 to 10. You put the price, then you put at the percentage of each service in relation to the total number of sessions. And for example, in this case, the 1-to-1 is only for testing and evaluation, very high price, but only 3% of the volume. Then you have 1 to 3 sessions with a therapist and 1 to 3 sessions self-paid by the client with an instructor. And then you can look at the opening hours. In this particular case, it's only open weekdays, and it's a country where you have only 220 working days. So even though the salaries are relatively low compared to, let's say, US levels, you have much fewer working hours and higher social costs and vacation pay multiples. In this case, it says it has 5 therapists and 5 instructors, but if we look here, we can see that the effective hours are excess, so the staff balance is over, and we can change this to 4 therapists, and now it is within the acceptable range. And also we have 4 instructors, we turn that into 3.5, and again, we have the right balance. And then down here we have annual rent for 220 square meter. Also here we can play around that if, let's say, we have 150 square meters, for this number of devices, it's just too small. And so 220 is the right number. So number of devices is 21 in this center. Write-off period, amortization 8 years, 80,000 other investments with 5-year amortization and 5-year payback time in the loans with 5% interest and 20% other costs from the turnover. So this way it is possible to modify how much other costs are involved if there is a manager or not a manager, and then we can see what the end result is. This is in euros and square meters. And we have another one for the dollar amount in the US. And in this particular case, we have only 1-to-1, around $100 per session. And then we don't have any groups with PT, but we do have 1 to 10 self-paid with an instructor and with a $25 session fee. And here there is a place in the US at the moment that has 30% insured and 70% are actually self-paid. So that's the balance there. Their salaries are totally different in the US, and therefore also the costs are different. But again, we can see that it is quite nice profitability with these volumes, 27,521 devices and so on. So it's very doable. And the question again is, do you have the patients? So here are some examples of existing clinics. This is an orthopedic surgeon in mostly operating knees. There's a spine system, hip and knee system, and a shoulder system. And for the patients to have an ability to take care of their spine and their shoulder on top of taking care of the injured or operated knee makes it highly motivational for them to stay longer as a maintenance, because basically that's a huge improvement in their quality of life overall. Here is a huge center with 31 devices. I think they have around 35,000 sessions per year. So this is more spine and neck oriented, but they also have the shoulder system, a little bit knee system. And bigger still, here is an installation with 37 devices. And in fact, this center is pretty much an overflow from the medical side, where people just don't want to go away and they stay and therefore want to continue to buy these services. And therefore the volume need grows there.